When you are writing the Cpnre, always think like an entry-level practical nurse. The safest, most legal, and most client-centered option is usually the right answer. The exam is testing whether you can apply nursing knowledge, not just recall facts. Start with prioritization. Always put the client's airway, breathing, and circulation first, followed by safety, pain management, and psychosocial needs. Acute problems take priority over chronic ones, and unstable clients are cared for before stable ones. If something seems unsafe or is outside the LPN scope of practice, your role is to report it or seek help from the appropriate professional. Infection control is another major theme. Remember the correct order for putting on PPE: gown, mask, goggles, and then gloves. When removing PPE, take them off in reverse order: gloves, goggles, gown, and finally the mask. For isolation, match the precautions to the condition. Airborne precautions for tuberculosis, measles, and chickenpox. Droplet precautions for influenza and meningitis, and contact precautions for MRSA or C. diff. Pharmacology questions often focus on safety. For example, for potassium must never be given as a push injection. It is always diluted in fluid. With opioids, watch closely for respiratory depression, especially if the rate drops below 12 breaths per minute. With insulin, know the onset and peak of different types, since that's when the client is most at risk of hypoglycemia. Anticoagulants like warfarin and heparin require close monitoring for bleeding. Vancomycin must be infused carefully to avoid red man syndrome, which causes flushing and hypotension. Be ready for emergency care situations. If a client has a blood transfusion reaction, stop the infusion immediately, keep the 4-line open with normal saline, and notify the provider. In the case of an allergic reaction or anaphylaxis, your priorities are to maintain the airway, administer epinephrine, and call for help. For post-operative clients, your very first concern is always the airway and vital signs. Some common conditions often appear on the exam. In diabetes, hypoglycemia shows as sweating, tremors, and confusion, and it should be treated right away with a quick source of sugar. Hyperglycemia presents with the 3 polys: polyuria, polydipsia, and polyphagia. In congestive heart failure, monitor for fluid overload, weight gain, edema, and shortness of breath. Clients with COPD often have lower oxygen levels as their baseline, so avoid giving too much oxygen. For stroke, remember fast, check the face, arms, speech, and note the time symptoms began. Finally, remember your professional responsibilities. Documentation should always be objective and factual. Never include personal opinions. Consent must be informed, voluntary, and given by a competent person. Confidentiality must be maintained unless the client consents or the law requires disclosure. And as a nurse, you have a duty to report unsafe practice, neglect, or abuse. Tips for exam day: read each stem carefully. Underline keywords. Eliminate clearly wrong answers. If torn between two, choose the one that is safe, within LPN scope, and client-centered. Manage time, don't get stuck too long on one question. You got this. Good luck on your exam. Don't forget to subscribe and hit the bell button to get notified when important videos like this are out.